Most people think a tooth infection is harmless. Just a little pain, a little swelling, something you can ignore for weeks. But what if I told you that a simple tooth infection can travel from your mouth, straight into your brain? And once it reaches the brain, it can cause brain abscess, meningitis, or even sepsis. And yes, people have died from it. Everything usually starts with something very small, tooth decay. When bacteria destroy the enamel, they slowly reach the inner part of the tooth called the pulp. Inside the pulp are blood vessels and nerves. Once bacteria reach this area, the body reacts, and the infection becomes a dental abscess. That's when the pain becomes intense, throbbing, and impossible to ignore. Here's the dangerous part. Your tooth is not isolated from your body. The roots of your teeth are connected directly to your jawbone, your blood vessels, and the nerves that lead to your brain. Once the abscess grows, bacteria don't just stay inside the tooth. They start spreading into the surrounding tissues. That's when your face begins to swell, your gums become painful, and the infection starts looking for a way to travel deeper. Your face contains one of the most sensitive nerve systems in the human body. And some of these veins and nerves connect directly to the brain. This means bacteria from a tooth infection can travel through blood vessels and reach the brain area itself. When that happens, the infection can create something extremely dangerous, a brain abscess. A brain abscess is not just an infection. It is a growing pocket of bacteria inside the brain. And the brain has no space to tolerate swelling. Sometimes, the infection doesn't even need to reach the brain directly. It can spread through the bloodstream instead. This condition is called sepsis. When sepsis begins, the body goes into emergency mode. Heart rate rises, blood pressure drops, organs slowly begin to fail. And it all started from something as small as untreated tooth decay. Many people ignore the warning signs because they think tooth pain is normal. But these are the symptoms that should never be ignored. Severe tooth pain that doesn't stop. Swelling in the face or jaw. Fever. Bad smell from the mouth. Difficulty opening the mouth. Headache that feels different from normal headaches. These are not just dental problems anymore. These are signs the infection may already be spreading. If the infection reaches the brain, the symptoms become much more serious. Confusion, severe headache, blurred vision, vomiting, difficulty speaking, sudden weakness in the body. This can lead to meningitis or a brain abscess. At this stage, the person doesn't just need a dentist. They need emergency medical treatment immediately. Many people delay dental treatment because the pain comes and goes. Some take painkillers and wait for it to disappear. But the truth is, when the pain disappears suddenly, the infection may not be gone. It may have already spread deeper inside the body. That's why dentists say, pain that disappears without treatment is not always a good sign. Sometimes, it means the nerve inside the tooth has already died. A tooth infection may start small. But it can spread silently, dangerously, and sometimes fatally. Your mouth is connected to your entire body. And ignoring dental infections is one of the most dangerous mistakes people make. If a tooth hurts for days, don't ignore it. Because sometimes, the pain in your tooth is already a warning from your brain.